So gastrointestinal issues generally stem from infection. I mean, that's a very common cause. But what is typically not done with GI issues? A stool test, to check for infection. So just to draw a comparison for urinary tract infection symptoms, right? Somebody's having frequent urination, trouble holding their urine, right, has come on acutely. What do? We check the urine for infection. So we don't take a catheter and go up the urethra to see what does the tissue look like. I mean, that might happen after an infection is ruled out, but certainly not before. So with the gastrointestinal system, what's done? Generally, they'll do a colonoscopy and not even test the stool for an infection. So you have a system, right? Urinary tract system. We test the urine because there's likely an infection when symptoms develop. The GI tract, there's symptoms. What do? Well, what do? We test the stool, but in terms of the mainstream medicine, what do? They do a colonoscopy and look at the tissue, and many times nothing's there. Maybe they'll see a little bit of inflammation. Oh, we have to treat the inflammation, suppress the immune system, some immunosuppressant that costs thousands and thousands of dollars, but generally not test for infection. So what should be done? Test the stool for infection. You can do a culture. Sometimes a culture will show, sometimes not. The best thing to do is a PCR, where you're actually testing for the genetics of the organism. And especially when it comes to a fungal infection, fungal overgrowth, fungi are very difficult to culture in general. So a PCR is the best way to go. And in general for bacteria as well. The right medium is not always used in terms of the culture medium. So PCR is the best way to do that. And then sometimes it's not infection. There's no question, sometimes it's not. But it's a deficiency in the good bacteria. The microbiome is deficient. So that's where probiotics and the stool transfer, those things, it can be absolutely remarkable. We've seen hundreds and hundreds of patients that have had gastrointestinal issues for years, diagnosed with Crohn's, colitis, irritable bowel disease, and hemorrhoids, and right, we do tests. We see there's an infection. We treat the infection, and right, the symptoms get better. And it's as simple as that. Testing properly, treating properly, and then right, you get rid of the infection, but then you have to benefit the environment. It's that whole Pasteur-Claude Bernard argument in terms of is it the microbe or is it the environment? So it's both. It's not just one or the other. So you want to treat the infection, you want to build up the environment in terms of the good guys, the good bacteria, and then you certainly want to keep the inflammation down. So probiotics, and then something that we make as far as referral medicinals goes, we make the DGL, which is a chewable deglycerinated licorice root. So the deglycerinization, that keeps it from affecting the blood pressure, but it has the remarkable ability to reduce inflammation in the gastric mucosa, the gastric tissue, and it has some antimicrobial property as well. So, when it comes to a GI condition, just the takeaway from this is proper testing. And if your GI specialist or primary care provider does not do a stool test, you got to find someone that will do a stool test. because just like the urinary tract, we test the urine, the GI system, you got to test the stool, not just go and look at the tissue. The stool is going to tell you what's really going on. So God willing, good health, and only good news.